Hello, everyone. And nice to talk to you from Ireland. A little bit of advertising. We're known as the country of 40 shades of green, very green part of the world. Just to let you see where we are in the world, for those who mightn't know. Just briefly. That's Ireland. And there's India. Look how small we are. I know most of you, and there, just to let you see the size of the Ireland, how small we are. We're about 400 kilometers by 250 kilometers in size, and a population of 7 million on the island of Ireland. So that's a little bit of background. I have been in recovery, as I said, since 2010. I came in, I would call it already knowing about recovery, because my brother had been in it for many years before me. And I resisted joining because we all know about the stigma of mental health, and to admit to yourself that you need help takes time. The main book in recovery is this book. A lot of you know about it, but just you can find out more about it later. We run meetings in Ireland, a physical meeting. It follows a structured format, and the format involves the meeting starts, the way we operate, we start on time and we finish on time. For example, a meeting would start, I run a meeting in the center of the city. It starts at 7 p.m. tonight, and this is the poster for it. And it finishes at 8:30, out the door at 8:30. It's a good discipline to have because people know when it is going to end. The structure of the meeting, we read a chapter from the book. It can be this book, or it could be other books. There's another great book. Again, you can find out details about that again. You'd read a chapter. We would then read from the group leader's guide often. And the group leader's guide, the concept of the group leader's guide is the instructions on how to run a meeting from Dr. Abraham Lowe. And we follow his methodology, and there's good reason for it. And we're taught to use recovery language and speak in a certain way. We don't want people bringing in other concepts, or sometimes people might talk about religious concepts. It's not that they can't be valid, but we have a certain language we use, and it means that if somebody uses the language, people can understand it and what it's referencing. Whereas if other people start making up sentences, you have to decide, is that valid language? Is it correct what they've said? Because sometimes people might say things that and we would have to correct them and say, well, that's is a conflicting statement, or it's anyway, that's that aside. So our meeting, as I said, we read from the group leader's guide, only a small segment, and then we would go into an introduction. At the introduction, we would go around the table and introduce each person by name. And so I would say, I'm Charles, I'm the group leader, and then the next person. And the reason for that is that if there are new people, we want people to help them to learn the names. And so once we've done the introductions, then we go into the example period. And the example period is where we're using the teachings of Dr. Lowe, the methodology, and it's a 4-step process. Again, some of you know. So 4 steps. Step 1, it's an example. So you give an example of a situation where you got worked up. We use the term worked up. And that could be angry, could mean you're feeling low or unmotivated or anxious. So it might be I got a phone call from somebody and I felt worked up. And then step 2, you talk about your symptoms, and your symptoms would be, I felt worked up. I felt a churning in my stomach, a sickness in my stomach. I felt temperature. I felt physically how it manifests your anxiety. And then you talk in step 2 also, you talk of your racing thoughts, what's going on inside your brain, what thoughts you're having. And they can be sorry, is that somebody? They could be, I can't talk to this person. They always make me feel bad, or I'm not able to talk to them, or I'm useless. You can, all sorts of negative language. And you try to tease that out. Then you move to step 3. So step 3 is where you use the spotting. We call them spots or sayings from recovery. And the reason we want people to use the language correctly is that the spots refer to the texts. So if you start using language that doesn't refer, if you make up your own sentences, well, first of all, I have to say, is that correct? And sometimes I might stop the person and say, sorry, that isn't a recovery spot. We can discuss that at the end, but please stick to the language. And so once you've done that, then you go to step 4. And step 4 is the spots should have helped you deal with your symptoms. In step 4, you talk about how I would have functioned prior to knowing of the recovery methodology. And that can be, sometimes people would say, I just wouldn't have answered the phone, or I wouldn't have got out of bed, or whatever it is. And that demonstrates to you and to the group how things have changed since former days. And somebody please mute. Not mute. Anyway, so those are the 4 steps. Once you finish the 4 steps, we might ask a question to help the group. I might say to the group, what brought you to recovery? And that would help, because with new people and older people, people in longer, it's helpful because for example, I would say I came to recovery in 2010. I came because I had psychological tiredness and anxiety, and I've been coming ever since. Statement done. That's it. That's all we want to hear. But that tells the group, oh God, he's been in for a long time. Okay. Now, once I've finished that, my job then as the example giver is to keep silent, and the group then, so there could be a group of 5 or 10 in the room. Group will then, you go around the group and you go around. So if I'm the group leader, I would say, I'd start and I would say, somebody volunteer, but I may go around the room and say, John, do you have a spot? And they would, and if they don't have a spot, they're to just say, I pass. They're not to give an explanation or an excuse, or just say I pass, and then you go around the room. So a person might use spots, and spots, this is an example, you can't read it, but it's a listing just to help people who are new, who have it's like a bit of an aid, but when you're more experienced, you don't need it. And you don't need it, but and spots are simple things like, if you can't change a situation, you can change your attitude toward it. That's a spot. And feelings can be expressed and temper suppressed. So if that person who rang me up and I found them irritating and annoying, and I feel like saying something very rude, I have a choice, and I don't have to express my opinion. And often the opinion is maybe not valid anyway. And it can be very rewarding when you realize that I didn't get into an argument. I didn't, because the argument is temper, and temper, a spot we use in recovery. Temper is a dubious luxury for the average person. That's the average person in society, but it's poison to the nervous patient, because the consequence of temper can live with you for days, weeks, months. You could be talking about this moment of temper. So it could ruin an otherwise tranquil existence. Dr. Lowe would teach you, this again is a spot, you don't have to express yourself. He doesn't ask us to be angels or saints. You can express yourself without temper. You could say to the person who's ringing you up and maybe is rude, you could say, sorry, excuse me, will you please speak in a more, difficult for me, will you speak more calmly? That's it. And then if they don't, you can say, well, sorry, if you're not going to speak calmly, if you don't mind, I'm going to hang up. That's a much more pleasant interaction than you shouting. And also it's like you can be teaching them recovery too without them knowing it, you know. We can all express ourselves without temper. They may have a valid criticism of you, but it doesn't have to be, and it mightn't be, you know. Why didn't you ring me? And I said, well, why should I ring you, you know? Anyway, so that's how recovery works. And at a meeting, we would have several examples. Now, we would hope to have, say, 4 examples at a meeting. Each example takes roughly 15 minutes. And then, so we have a range of examples. And for example, at the last meeting I had, there were 4 examples by Betty, who talked about an issue with a bus, by a person called Cass, by a person called Marie, and a person called Colin. I just keep a little note, and I keep a note of the names of the people for myself as the group leader, so that I don't forget people's names and one of the disciplines I also instill is constantly repeating people's names, because when people come to recovery, they're often very distracted, very nervous. They possibly have a lot of symptoms, so their memory is not good. But this process can help them improve all those things, and it can take time. So that's how a recovery meeting works. And then at the end, we would have the mutual aid where people would ask questions, and maybe we would discuss statements that people made during the meeting that may not be a spot, and we would explain to them why either it's an illogical statement or it's not relevant, and I don't know if people in the group know, but recovery is non-religious, non-sectarian. We don't discuss law. We don't discuss legal issues, sexual issues, political issues, your medication, your symptoms. We do not want to know. I don't want you to come in and said, well, I have bipolar and I have compulsive whatever, and I said, that is a label, and labels, so that's fine. But you'll often hear people say they were told that they were such and such a symptom, and they may go to another professional a few months later and they'd say, no, that's not what you have. It's not relevant. What's relevant is you're learning this methodology, which will help you improve your mental health. And in due course, it has been proven, and there are examples where people improve their mental health and live a normal and productive life. There are people who, we have a member in Ireland, he's an elderly man now, but he said he was able to work all his life, and he has an ongoing bipolar situation, so he can be up and down, but he's been able to work all his life and keep a full-time job. And he said that would have been impossible without recovery. And now he also takes medications. At recovery, we never discuss people. We don't say, oh, you're on such and such. That's not allowed, because you leave that to the professionals. And we don't let members talk about, well, what do you think? And you're not supposed to advise. So that's recovery. I think it's wonderful. I use the statements. I talk to people and I say, I feel like I am selling gold bars at half price. I feel you're trying not to be too enthusiastic when you tell people about recovery, because if you're too enthusiastic, people think you're a fraud. And it can't be that good. Well, it is that good if you work it, if you use it. And everybody, whether we have people in recovery who are former psychiatric patients, people who never had a diagnosis. And so the point being, we have a range of people in recovery. We have people in recovery who are cross-addicted, maybe. Some people have alcohol problems, gambling problems, debt problems. That's irrelevant. Recovery helps. And they can also attend other groups with regard to their drugs or their alcohol. but it's there are many people who will report how it is helpful. Out of interest, if anyone, that's our web address there, if anyone's interested. I've some of the other activities I do, I was in on Monday talking in one of the psychiatric hospitals to patients about recovery. We would like to do more of that. I myself am a volunteer. I'm not paid. All the group leaders are volunteers. It is a big challenge to get volunteers. The reason we shrunk, we had to close because of COVID, and we opened up Zoom meetings to compensate, but to reopen was much more difficult than we realized because people used the opportunity to retire as volunteers. And I don't have a list of people who would volunteer to be a group leader. I have plenty of people who would be well capable of being a group leader, but they don't want to have the challenge of doing it. Sorry,
Would you please mute?
Yeah. So I think I've said enough. Maybe Ganesh, is there something else you would like me to say? I don't want to talk too much. I could answer questions. Let me see, is there anything on chat? Or if anyone wants. So Ganesh, is there something else you would like me to talk about?
Yeah, I think the lexicon which you had mentioned, the particular language which Recovery International uses, perhaps you could elaborate a little on that because it's very important. I see Suresh has raised his hand, and perhaps you can address what he has to say and then go on to the lexicon or the language of recovery.
Oh, okay. So Suresh, will you unmute and ask your question?
Yeah, I could get, but there is I just wanted to recreate or reconfirm. Can you hear me? Am I audible?
Yes. Yes.
Yeah. So we will share our facts, and then it will be discussed in the group like that. We have to do like the 4 steps you said. With that 4 steps, first, second, third, fourth, that we have to participate that way. It is an interactive one. Are you getting my point?
I do. I think I do. I'll explain. The 4 steps are the 4 steps that the example giver follows. Once the 4 steps are completed, the group then will give their spots.
Okay.
And when the person gives the example, you do not discuss, you do not interrogate. The only person who can ask questions of the example giver is the leader.
Okay.
Everyone else is to sit quietly and keep quiet. Okay. And no one is to give, and even when you're spotting, no one is to give advice. You should take this drug. You should leave that bank. Now, mutual aid, maybe a little discussion, but no. It's more a case you're empowering the person to deal with the problems in their life on their own.
Can I start with mine one? Can I share my this one? So the same what you're going to take the group sharing. That's what
as Sureshji, as of now, we don't have a session planned per se. But yes, you're welcome to get in touch with Charles or anybody from Eklavya Foundation and come on to a regular meeting.
If you're a person who attends recovery, here's worth saying, if you're a recovery member who attends meetings regularly, we have a thing called the 5-minute phone call. I'm not sure if you use that in India. It's very effective. So where you would have permission to ring or contact another member and go through the 4 steps, and they then will give you some spots to help you. And what's good about that, if you mute, Suresh, sorry. What's good about that is that it's the act of ringing can help a person reduce their symptoms, because they they lower the act of making a decision. And this is one of the spots in recovery. A decision steadies us. You've moved the muscle. These are things that you're taught, that your muscles are, your body is a holistic instrument. Your muscles are connected to your brain. And when you're feeling low or not able to cope or unable to move, well, Dr. Lowe would say, well, can you put your foot on the ground? Yes. Well, so the point, you're making statements that are not true. And by doing something, it could be as simple of standing up. You can do that. Maybe brush the floor or wash a cup, or in other words, and by the act of doing that helps reduce symptoms. So these are things you're learning in recovery. So Ganesh asked me to talk about statements, and I'll just look at some of the spots. And spots would be, for example, humor is our best friend and temper is our worst enemy. And what that means is that if you can laugh at things sometimes and stop taking life so seriously, it makes a big difference. So that's, sorry, I just see a hand up there from Mugda. So do you want to ask a question if you're on mute?
Yeah, hi, I have a question.
Yeah.
Am I audible?
I can hear you, yeah.
Okay. Like, for example, if I'm worked up in some situation and I'm not able to remember any of those spots, so what do I do in that case? Like, I have not memorized all of those spots, or I don't have them in my mind. So what do I
Get a
do in
copy
that?
of that. Get a
Yeah,
copy of it,
okay,
fold it in 6 and put it in your pocket
okay,
and take it
okay,
out. Or write them on a small scrap of paper,
okay.
ones that are relevant to you.
Mm-hmm.
Or another very important thing in recovery that we're taught, motionless sitting or motionless lying. I mentioned that our body is connected to our brain.
Right.
If you're feeling anxious or worked up, if you sit in a chair and do nothing, and just focus on a point in a wall or in a leaf and sit there for 10 minutes, your symptoms will have decreased, guaranteed.
Okay.
I have no, if they haven't decreased, you're obviously not focused on relaxing. You're focused on the thoughts in your brain. And what we're asking you to do is focus on an object. Say to yourself, relax my feet, relax my legs, relax my torso. And when you get yourself relaxed, your mental symptoms will go down, and then you'll be more able to cope. Okay?
Okay, yeah. Thank you so much, Charles.
Thank you.
Hello.
I see Anil has a question.
Good evening, Charles.
Yeah.
Nice to interact with you. I have a question related to what Mugdha asked just now. And do you think that attending the meetings regularly and also reading the examples in the past recovery newsletter or on website helps to recall the recovery tools when any disturbing situation is occurring? Do you think that that helps?
Of course. I tell you what I think. I think rather than reading extracts, you should be reading. Of course, extracts are good, but the discipline of reading the material that Dr. Lowe spent his career developing this methodology against other professionals who were anti-self-help. And this is a proven methodology. And reading extracts in articles is fine, but what you want to guard against is that people start reading other materials and other books. And I would also say regular attendance at meetings is important. And this is one of the challenges at recovery. People come, they hear of recovery, and the first comment they make is, I never knew about this. The things that they become aware of, it's free to attend meetings. we, at a meeting, the way we operate here, we ask for a suggested donation of up to €5.
Mhm.
But you do not have to pay. That's only a suggestion. But I said to you, people come, they might come for a few meetings, they get a little bit of relief and they disappear. But and you're warned that you will get you will always get an initial relief. And the reason you get the initial relief is because you've made a decision. You're doing something. But you haven't learned the method, and you've got inspiration maybe from listening to other people, and then you go away, and people can come back sometimes 20 years. Like I've had people come back after 20 years and say, I wish I never. But yet they disappear again. And like I have a man who lives locally, and I'm so sad to see him. He looks so sad. And he just tells me recovery doesn't help him. And I said, but Ray, it did help you when you used the method. But I have told you that you have stopped using the method. So it's not going to work because you know of the existence of recovery, or the book is sitting in your shelf. It's not going to work. And so stop. So when a person does that and walks away, we never pursue them. I will not ring Ray and say, Ray, please. I did a little bit, but if he's not willing, what's the point? Okay. I see Anil is asking a question. Well, maybe the hand isn't. Sorry, that I was only speaking to you. Is there? So I mentioned that meetings are free to attend. The reason we say €5, if you went to a cafe here in Ireland and got a coffee would cost you €3 about. And so if you had a coffee and a bun, it would be more than €5. And if somebody wants to make a bigger donation, we would ask them to do it privately through the website or give it to. What we don't want is the people who. What we don't want is people. There are people who aren't able to pay, and we don't want them to feel embarrassed, because we would have people coming to the meeting who could be very wealthy and could say, that's worth €100, and I would reprimand them for that. Now we have people coming, and I would see them in the cars they drive and the way they're dressed, and they don't pay the €5. I find that amazing, but we never comment. So there you go. So Ganesh, you have to unmute.
We have, yeah, sorry about that. We have a question in the chat box. What do you do to motivate to continue if you see a tendency to reduce attendance?
What do I do to motivate? I talk to people. I tell them when if you rang me for a 5-minute phone call, the first comment I'd make is, did you use recovery? And you might say no. And I would say, well, ring me back when you have, and I'd hang up. Now, I wouldn't do that to everyone, because some people are in such a bad state. But if you were a regular attendee and you did it a second time, you wouldn't do it a third time. I would say, Ganesh, do not ring me if you haven't practiced the method. Do you hear me?
Sir.
But I would not do that at a group session, because it's not fair. But engage. I'm not saying all group leaders are like that, but are all people are taking the calls. It doesn't have to be a group leader. But I would make comments to people that you're making spots that you're not using. Like you might say, oh, the humble muscle educates the brain and a decision steadies us. And I say, great. And I would say, okay, Ganesh, you said that. What decision did you make? And he would say, what do you mean? And what did you do? What do you mean? And I felt like saying, but sure, I could get a parrot. I could turn on a tape recorder. like we've had people come to recovery who are very bright and very intellectual, and they could read that book and quote it back word for word, but they're not using the method. And whereas we have other people coming who can barely read the book and they are applying it. And we find that people who are less educated, often people who are in the trades, people who are plumbers or carpenters, they have been taught to follow directions, to follow steps, and they love the recovery because they've got it clear and they don't get into an intellectual discussion. There you go.
Go on, please.
Hello, Charles. What we have found, I mean, as in our group, that whenever people come for the first time, when they see that this recovery method, it is very simple. But sometimes what they think, it won't help them because this is so simple, and my symptoms and everything which is happening to me, it is so overwhelming that it will definitely not help me. So so what do they do is, they just take those material. We generally advise them, and not advise, but we just suggest them that what you can do is read those spots early in the morning and before you go to bed. So if daily you should do that, so when the time comes, you will be in the position to recall those tools. But these spots are very simple to understand, so people think it won't help them. So have you faced such issues in your group?
Absolutely. Let me say one thing to you all before you start. The problems we have here, it's universal. I've listened to them in the States and in Canada and Puerto Rico, and it's all this. That's why I say we're bigger per head of population. Bigger per head of population, but our problems are identical. And if a person came to my meeting and said it's not going to help me, there's no point, I would say, well, it will. There are examples, it does work. And if they insist, I said, well, you might as well go then. And that can be disarming for them. Because if they truly, truly believe it, well, what's the point? You often live with your OCD or your whatever you have decided, whatever stupid professional has told you, there's nothing that can help you. And if you want to believe that, leave the chair, leave it for somebody else. And that disarms them because they think you're going to, oh, please stay. Oh, let me ring you, bye-bye. And I've dealt with a person who has a compulsive issue, a friend of mine who's never come to recovery. And I'm sad that he keeps going on about how it wouldn't help him. Now he attends a person who's Indian does meditation. And of course meditation helps, but it's not the solution. It's a help. It's one of the helps. It's like motionless sitting. That's a form of meditation, but there's more to recovery than meditation. Now, if it helps him cope, fine. But I know recovery. But I've presented the recovery material to him. I've told him about it. And I said to him, now I will never discuss it with you again. It's up to you to decide whether you want to go. And do not tell me I haven't gone yet or yada, yada. I don't want to know because it's up to you. You're a big boy. Now, we hand out a new members pack. And on the new members pack, we have a statement up in the corner and it says, note, this is an introduction pack. If it's no longer of interest to you, please give it to someone who may welcome it or post it back to us. We will reuse it and save money. So that's my attitude to someone who doesn't, don't waste my time. Bye-bye. And they may be right. They have a better methodology. And I said, well, let me know and I'll tell my members. I've had someone on with OCD and they think this is better. And I said, why don't you give that a go too? Because recovery is not, we're not saying if you come to recovery, we want you to keep following your mental health professional's advice. We want you to, if you find meditation, yoga, physical activity, again, your body is connected. Physical activity is good for mental health. So all that is good, but recovery is king if you follow it. There you go. Anyone else? I see hands up, but I don't.
Anilji has raised. Anil,
Okay. My question is again related to what Manjari asked just now, but it is our observation in the group that many people like intellectual churning. They think that if anything comes in the group, it should be seen from variety of angles, and various aspects of it should come out. And in a recovery method, somebody gives example, and within 5 minutes, everything is over. We don't continue with the same example. People like it. And so, as Manjari said, that this is the sometimes attitude. And
who's the group leader of that group?
Because in other aspects of our life, generally, people prefer to have a longer path, intellectual path, and
can I answer that now? Who is the
yes,
group
you
leader
answered already.
of the meeting you're talking about? Is the group leader in attendance at this on this thing? I say they are. I would say to the group leader, you should stop that discussion immediately. Do not allow an intellectual discussion. You say, sorry, excuse me. I at recovery meetings saw something interesting at a recovery meeting. If you sit at me, and sometimes I might do things like this to a member. In other words, silence. You're not supposed to be speaking. You're not giving the example. Or I might do this, or I might point at a person to, and you have to respect that a person, whoever has the right to speak, is given the freedom to speak when they're allowed. And regarding intellectual discussions, if you allow an intellectual discussion at a meeting, there may be 3 people who are capable of having a discussion. And I would suggest if you recorded that intellectual discussion, there'd be a lot of incorrect statements used. So what I would say to the people, if they want to have an intellectual discussion, I'd tell them about the local cafe, and you can retire after the meeting and have your intellectual discussion. But at this meeting, we will follow the recovery method. And if you allow intellectual discussions, the meeting will die. And you may be left. And I have had to deal as the group leader with meetings where I go to a meeting and the leader is acting like a teacher. And I'm very disappointed, and it's very difficult because they're volunteers, but I feel very frustrated, and I say, you're not doing it following the method. And
Ganesh?
So there you go.
Yeah.
Ganesh,
can I ask one additional question?
Go on, sir.
If we want to go to a hospital, or we want to talk to a body of professionals, I understand that because usually, apart from recovery, we are also working in the area of awareness, stigma removal, and so on. So our usual way is to prepare a presentation and make it in front of the hospital, the staff or whatever, and the mental health professionals. Now, if we want to take recovery method to hospital staff or hospital administration, mental health professionals, in what way should we let them know about this method and the usefulness of this method? Thank you. Yes.
If you're talking to professionals, one of the things that professionals dislike is that self-help groups are sabotaging their treatments, telling people, oh, don't be listening to this. Oh, I don't take that drug, I take this drug. Or don't this and that. And people like that are dangerous, because remember, you are not a professional. You do not understand. And that the professional could be dealing with a very tricky person who's got very bad and has come, they're in a much better position than they were, but they need that medication. And so if they get the perception that you're a type of organization that's going to be, that you're some magic bullet, they will not. If I was a professional, I would be looking at you going, oh no, here we are again, another secret potion. People, you know, when it all has gone down the river of, you know, it's all fallen apart and the person arrives back in hospital, you know, they won't appreciate recovery. So if you're talking to professionals, again, you see, you have to respect, if you're sitting with a group of psychiatrists and I start talking about psychiatric principles, how much respect do you think they'll have for me? They might say to me, and what medical qualification do you have, Mr. Kelly? None. And what books have you read about the topic? None. Well, other than, you know, but in other words, everybody thinks if you read something on the internet that you're suddenly an expert. And I come back to recovery. Recovery is simple, but it's not easy. Follow the method and stop trying to become some sort of an intellectual. I'll say one final statement. I had a person come who was a professor in Greek or something from a local university, and who had obviously suffered from low-level psychiatric issues of anxiety all his life. And he comes to the meetings, and he came to about 5 meetings. And he said after one night, he said, after we read a chapter, I could write that in 3 paragraphs, he said. Very dismissive of Dr. Lowe. And I sat there and listened. And he said, what do you think? He says to me. And I said, listen, let me say it before we start. I'm not an academic. I'm not a professional. But I respect that Dr. Lowe spent his life, he spent 25 years developing this program. And he wrote the chapters that length for a reason. And I think to say that you would, the point about a lot of the chapters is repetitive. It's repeating the messages over and over again in different ways and different angles. So you could say, yeah, the book, you could summarize that book in a quick article, but that won't be much good to someone. If you're really trying to learn the method, you have to, if you want to learn to play tennis, you can't read a book about it. You have to get the tennis racket and start hitting that ball. And the professional tennis players have to hit, to become good, they have to hit over 2,500 tennis balls per day, every day. So if you're trying to learn...
Charles, a couple of questions have popped up in the chat box. Very related and very the simple but not easy. For example, you're just saying it takes a lot of practice. So that's what is the not easy part of it. It's simple to hit a ball, but to hit a ball repeatedly is what we are looking for. And also, there's another person who has said, will documentation help? They have a question on journaling. So perhaps you could throw some light on this. And Mr. Joshi has his hand raised. Perhaps you can take that as well and then wind up.
Okay, so let's just try and break this into simple individual questions. Give me the first topic. What do you...
That is simple but not easy. Takes a lot of practice.
Yeah, well, what that means is that the more you practice a method, the better you'll get at it. And I have a lovely member who's been in recovery for many, many years. And he is now in his, he joined recovery in, I think about 1975. And he would attend still because he finds recovery helpful. And he said about a year ago, about one of the spots, I get it now. And what he meant was that I get it in here. I've said that statement for years, and now I get it. I understand it. So that's what it's all about. And if you're learning to play tennis, if you're practicing regularly, initially you'll be able to play a good game. And the more you practice, the higher up the levels you'll go. But the thing about recovery, you attend recovery, you can have setbacks. You can have events that you feel you've fallen down. Oh, I'm back where I started. People will say things like that. Oh, it's as bad as ever. That's not true. And you can get back on the horse a lot quicker than you could back in the day. So that's that. You asked about journaling. Absolutely, journaling is a good idea. It's like a diary. It's a good thing. You can look back. We talked about steps 3 and 4. You could look back. If you were keeping journal for a year, you could look back at what you were writing a year ago versus what you're writing now and see the help, or you'd remind you of stuff. I know a member who said what he does when he has he practices the 4 step, he would do it and he would write out the 4 steps and write out the spots he's thought of and date it and think. And then he would look back sometimes and he said, I don't need recovery. Well, it's not that I don't have those big crises, as many as I used to have. I'm coping a lot better. And they find it very helpful. Was there another question I haven't answered? Oh, I see. I'm looking here at the thing, as a mental health advocate, if you recognize that the method may not be helpful to a member, do you still advocate?
Mr. Kelly.
Yes.
Mr. Kelly. Yeah, a small question from me. This is Rajendra. Question is, you said the meeting goes in 4 steps. Where exactly the caregiver comes into picture in these steps? I know more or less the spots are shared by the patient or the person who is suffering, but where does exactly the caregiver comes into picture?
Sorry, what do you mean by the caregiver?
Caregiver, for example, my spouse, my wife is a patient and she is undergoing treatment and we are attending the meetings. So if I am attending a meeting along with her, where does my exact role comes into picture in these 4 steps?
Very simple. Participate in the meeting, learn the steps, learn the spots. It will help you because you are also probably suffering in living in that environment. And you can support the person by using the language in normal conversation. You know, listen dear, take it in small steps. Let's do one thing at a time. Endorse yourselves for the effort. This is another very important principle in recovery, that you endorse for the effort, not for the outcome. And because if you're endorsing for the effort, you can split that into multiple endorsements. Whereas if you endorse for the success or for the achievement, you know, you might never finish the job and that doesn't matter. But the point is, oh, you'd be saying at the end of the day, I didn't clean the kitchen. But you slapped the floor, you cleaned the counter, you washed the windows. Yes, you didn't clean the shelves and you didn't clean the whatever. But so the point being, if you endorse yourself for all the efforts you're making, the endorsements replace the negative thoughts in your head. It's a very important principle in recovery. When you're endorsing, you can't be blaming. You can't do the 2 things at the one time. And if you practice it, anyone can practice that. If you wrote out 5 positive statements about yourself or about the situation and repeat them like a prayer over and over, and then say to yourself, were you able to think about the other thoughts of your day, your negative? You can't. The brain isn't able to have 2 thoughts at the one time. So it gives you one relief and it helps reduce your symptoms. There you go.
Yeah.
Any other questions?
Thank you, Mr. Kelly.
Yeah, before we go close the meeting, Charles, Dr. Lowe mentions that it takes time to master the art of spotting, and it requires repeated application. And so how does one know that one can confidently spot for others and oneself?
You could be doing it. You could have attended only one meeting, and you could say, I can take things in part acts. Success. We're not talking about becoming, there's always room for more improvement. There's always improvement. There's always room for us all to improve intellectually, physically, yada, yada, yada. The point being, the difference between step 3 and step 4, in former days, how would you have been versus now? And this idea of becoming a 5th Dan at recovery, I would just say, if it's given me help, that's enough for me. And what I would say to people who aren't in recovery, family members, like I dealt with my brother who was suffering, who's had ongoing psychiatric issues for a lot of his life. And we sat down with a psychiatrist, and the psychiatrist had to explain to my brother that your brother who has had the psychiatric illness has been well for over 5 years. Why do you keep saying he's ill? And family can be very destructive in the language they use with their member. They say to you, oh, you're like your whatever, you're always, you're all the men in this family are depressed. These statements are rubbish, but they label people, and labels are terrible. And just because you're depressed today doesn't mean you're depressed tomorrow, and you'll be depressed always. And people say he's always depressed. Like, people like that should get a slap, because those statements are not logically true. And even the person who feels depressed, I sometimes would say to them, okay, I said this to one guy, I'll show you. I said, make a chart, and 1 to 10. How do you feel out of 10 today? Do you feel really bad? 1. So they might go 1 today, 2 tomorrow, and you'll find it creeping up. And then I demonstrate to them, you've been 8 for the last, that's your own perception of how you feel. Now, it's not there's no, if you're in pain, they often use the same principle in pain. Well, how are you feeling today, Mr. Kelly? How is your pain? And I would go, it's 8. Well, an 8 for me in physical pain, for someone who's used to living with genuine pain, they may be thinking it's 0, because the pain is so livable with. Whereas somebody who has genuine physical pain and has to be on heavy medication, their concept of pain is so different. Anyway, I'm rambling.
Well,
anything else?
Yes, thank you so much. I have one last question. If others permit me, there is one question in the chat box. Okay, so right in the chat box, you have where you have to get in touch with us for further details. And you're welcome to join us and learn about the 4-step method. Okay, Sneha has one question. Shall we take one more question?
Okay.
Yeah. As a mental health advocate, if you recognize that the method may not be helping a member, do you still advocate for and encourage other means of support?
Well, I'll always encourage other means of support, but how do you know it's not helping them? How have you decided it's not helping? We had somebody attend our meeting, an elderly lady, and she would hardly speak. She wouldn't read. I used to have to encourage her to give a spot, and I'd nearly tell her the spot to repeat. So I sat down beside her one day and I said, Rose, how is this helping you? Because I was feeling bad that she looked as if, like, why is she bothering coming? And I said, is this helping you? And she said, oh, it is. It's great. So my perception and her reality, you know, well, that's, what just so something to say at the end, we have yearly physical conferences. In November, we'll have another one. If anyone's over in Europe, you can come to Ireland, come to our conference. Free to attend. We don't charge. No, we might charge maybe. No, I'm only joking. We haven't charged yet anyway. You have to pay for your own accommodation. Now, India, massive population. If you decide all to come, let us know, because we might have to charge. We'd have to get a bigger venue. We've only 7 million here.
Yes, Charles, what you said, my personal experience, because Dr. Anil Vartak, he talked about this. He trained us about this recovery method in almost 2020, when the COVID started, and for 6 months, I have been practicing. I was reading those spots, because we were not meeting physically and we had other work, and for 6 months I was like, is this really helping? Because I was not having any psychiatric issue, but I was reading it daily as a discipline. And after 6 months, when I was into a distressing situation, and I realized, oh my God, this is helping me, because for 6 months I never thought, because it was simple. It was definitely not easy, because I did read it daily, twice a day. So from my experience, I say that yes, it helps, because but you have to keep practicing it. If you have to keep reading it, and it helps one day, because then it gets internalized. All those spottings, they get internalized, and you can use it. You have to consciously read it, but that's my take on it.
You're a good advocate.
Thank you.
What I'd say to you, I came to recovery in 2010, and I wondered, was I a fraud? Was I not taking? It's easy to put on this video. Oh, this is great. It's really helpful. But deep down, I was wondering, is it? Am I getting better? Am I taking it seriously? Yeah. And I used to talk to the group leader. I used to make a point of helping out at the end, tidying up, because a lot of people would just leave the room. Very, not very pleasant. They would leave the room, tidy up the chairs, etc. And I'd be helping, and May, a little old lady called May, she's in her 80s, wonderful woman. She said, Charlie, you're improving. I don't know if I believed her. It took me, but I kept going. I kept going because my brother had convinced me that this would, you have to keep at it. And it's one of the few things I've done in life that I've kept going at, as in, tennis or going to the gym. Or recovery, I think, is like mental gym. I often say people will go to the mental gym and tell their friends, I go to the gym, I lift weights, I do this. But they won't be willing, the stigma of mental health. They won't be willing to tell people, my mental muscle is weak and I have to work on my mental muscle. In other words, mental health, I call it the mental muscle. And recovery helps you strengthen, reinvigorate, you have a strength in your mental muscle that you think is gone. It's not. And the point is, with time, you can rebuild. I've improved my reading ability, my ability to speak to people. Like I find that I can speak to people and be more relaxed, and I think I partly learned that from recovery. And I learned that to know is not to know what's going on with other people. These are recovery spots. And you don't have to be exceptional. You don't have to be exceptional. And things like that are very helpful. And what else would I say? For people who aren't in recovery, for people who have heard of recovery and wonder, I have nothing wrong with me. Sometimes some of these people come and say, God, yeah, I came with my sister and it was great. But it can help anyone. It's all so simple. That's why Dr. Lewis, it's simple. In life, if you take things in parts and steps, and the spots you hear in recovery, it's not new language. It's language that's out. It's always been out there since time immemorial. But Dr. Lowe has tried to have these statements that link to it literature. Anyway, there you go.
We're out of time, but can we just take the last question, Mr. Joshi, and then I think we should wrap up. We are eating into.
Yeah, it's not a question. I mean, I was trying to say thank you on behalf of all, and on the practicality part, we welcome to India. I mean, as you practically suggested, not everyone can go and attend the your conference, but always you are welcome, and you can guide us here in India, and then we can have a mob here so that you can address them. Yeah. Thank
yes,
you.
most welcome. It would be nice to have you over. Well,
we have a joke.
Very true. Very true. Welcome. Yes.
We have a joke in Ireland. We use in Ireland. How do the Irish take over the world? With a mobile phone and a sleeping bag. We went to America with our sleeping bag and our mobile phone. Somebody will take us into their house. We then have children. I think they say 25% of the states have Irish ancestry. We did the same in Australia. We did the same in the UK. Now, India could do it in a much bigger way. But the point being, and recovery is simple. We can do it. My wish would be to have recovery meetings everywhere. It's disappointing that recovery is so unknown. It's disappointing that I say we're bigger per head of population than the States. That shouldn't be the case. I find it disappointing that recovery has been shrinking. There should be meetings in every town in Ireland, but there isn't, and it's a struggle, and that's the ongoing mission.
The nice thing about this is that we have the online platform. I'm sure that you're reaching out across so many miles and talking to us what has happened post-COVID. But double-edged sword, no doubt. But still, it's wonderful that we have these online meetings and the ability to meet, though we are geographically very far apart. Well, thank you, everyone.
Yes. I have a criticism. I have a criticism of India.
Yeah, go on.
I set up a meeting on a Friday morning at a time that suited India so that India could participate. They stopped attending. Why?
What? Well, Friday, what time?
The Zoom meeting. Do you remember? Well, one of the ladies saying she was on 2 years ago, and they came for a little bit, and then they stopped attending. Now, the point I'm making to you is that the wonderful thing about Zoom is we could have a Zoom meet. You could attend our meetings. Now, the problem, our meetings are, at the moment, it is, this is the time in Ireland. The great thing about the reason we had the Zoom meeting, the times of day, like a morning meeting seemed to work with your evening. So that was good. And I just love the fact that we're reaching out to other places. We have people on at the same time from Uganda, from Australia. I only joke about that, but the point being, like, if we can help each other, great.
Yes, very true. We learn from each other's ideas. I mean, you have an idea, I have an idea. We end up with 2 ideas each. So I mean, that's a wonderful way to. Thank you so much again, Charles, for the time you've devoted, and I hope to catch you again, possibly in India, even if not online.
I'll pay attention to the post for my ticket that you've paid for.
Yeah,
and I can stay in your house to cut down on your costs.
See, there are a lot of things we can do. A lot of things we can do. As of now, the best way is to reach out to you online, and we would love to do that a little more often to get into the groove of practicing what we know. Knowledge is just.
I could be the group leader for Europe and Asia.
Oh, certainly.
What about that? If I could set up a meeting in Everest, I'd do it. But like the point is, obviously, I can only do it by online. And then so if I could be part of helping it spread throughout India, and my name could be mentioned in hundreds of years' time. This guy, crazy guy from Ireland, he helped us.
Any parting thoughts you'd like to share before we close?
40 Shades of lovely country here. As President Obama said, we punch above our weight. But he did say that to every other small country in Europe when we looked online at his speeches. So it didn't sound. I was in India. Did I tell you that? Oh, I had some great experiences. And I traveled one day in a car, and in the back seat was a young Indian guy, a colleague in my company. And we were with a supplier, and the supplier was driving his car. It was a Honda. We were driving along, and some of the roads are in India, the surfaces aren't, they might be not great in some where I was driving. So he was driving along, and we were talking, and a truck comes toward us on the other side of the road. And the next thing, a bus passes out the truck. So there's a bus and a truck coming directly at us. And I'm sitting there quietly. And I know the driver is driving, and the guy behind me, the Indian guy, started to scream. And I'm going, well, that's not going to serve any good. So, and to your man, the driver drove onto the side of the road about 45 degrees, and we drove along and back up on the road, and we continued on. And I never said a word. And your dad said to me afterwards, you were very calm. I said, if you didn't know what to do, then we'd have had a problem. I knew, because he was calm. He was calm. And also in Ireland, because sometimes the Indian guy, I'll finish with this, the Indian guy used to be a little bit embarrassed about, say, the quality of the roads. And I'd look at him and go, come to Ireland. Now, the roads would be a little bit better, but we're a very small country. We don't have as many roads to look after. That's it. So
bye. Have a good one. Have a great rest of the day. And we're just winding up here. Thanks so much, everybody, for attending and contributing and the valuable exchange we've had of ideas. Thank you so much, everyone.
Thank you.
And Ganesh, if anyone has other questions, you can get back to me.
Yes.
Thank you.
Thank you.
Bye.
Thank you.
Bye.
Bye-bye, everyone.